Hi everyone, my name is Rebecca McComb. Now I'll be presenting a case study of a diabetic foot ulcer exacerbation. This is from nursing 440. So here we have MJ, who is a 58-year-old Hispanic male. He has had diabetes for the last 18 years with no other comorbidities. He has poorly controlled diabetes with his last A1C that was 10.2 at his previous primary care doctor visit. He has a previous amputation to the right leg below the knee. His current exacerbation includes is that MJ is currentently admitted to the hospital with acute osteomyelitis to the left foot and will require at a minimum of 6 weeks antibiotic therapy and PICC line placement. So MJ frequently forgets to take his blood sugar before meals and snacks. For the past 2 weeks, MJ's left foot has been red and hot to the touch, and for the last 5 days, he's experienced increased pain and swelling. The plan for his hospital discharge is to have a PICC line placed for IV antibiotic therapy and to receive daily home visits to assist with antibiotic administration and continue teaching. MJ and his daughter will require extensive teaching to ensure a successful treatment course for MJ. MJ's self-care capacity is limited at this time because he is limited at this time, but can be greatly improved with consistent teaching and self-empowerment. The current problem he's experiencing is acute osteomyelitis that requires proper PICC line use and timely antibiotic administration. His daughter is available and willing to assist in his care and will be an excellent resource for MJ to help ensure safe and timely antibiotic administration. Some challenges include the correct use of medication pump, ensuring his medication is administered 4 times a day every 6 hours as directed by his doctor, and ensuring sterile use of his PICC line. Some challenges that MJ is facing regarding his chronic condition involve glycemic control and the solution centers around education and self-empowerment, which can be reinforced by the home healthcare nurse. MJ is capable of correctly managing his diabetes. He has implemented an alarm system that reminds him that he needs to check his blood sugar and administer insulin accordingly. He also has dietitian appointments arranged by his case manager through his new endocrinologist office. MJ's self-care capacity will be greatly strengthened through education and self-empowerment. His self-empowerment responsibility through the technique of self-empowerment. So safe discharge planning for MJ revolves around patient teaching and education. It is important that MJ and his daughter understand the treatment plan and can demonstrate proper use of IV pump and how to piggyback antibiotics. It is important to have both MJ and his daughter demonstrate aseptic technique when using the PICC line. Home health visits should be scheduled and in place prior to discharge. After providing education to both MJ and his family, it is determined that it is safe for him to discharge home with home health visits every day for the next 6 weeks. His daughter has committed to assisting MJ with antibiotic administration, and MJ has shown marked improvement with managing his diabetes and completing daily self-checks to his lower extremities. So recently, since this new diagnosis, MJ has taken a more significant interest in his health since he was again diagnosed with osteomyelitis. The strategies that have been employed by the home health nurse, as well as the case manager assisting with his care at the micro level, are education and partnership. The technique of coaching has been very helpful to assist MJ and his daughter learn how to properly administer IV antibiotics, as well as helping MJ to solidify a consistent routine when managing his blood sugar and maintaining a diabetic diet. Partnership has been used to empower MJ to self-manage his care. An example of the nurse supporting MJ's transition from acute care to home care is his new habit of using an alarm periodically throughout the day to help remind him when his antibiotics are due and when to check his blood sugar and administer insulin correctly. So MJ has made significant improvements in his daily routine and habits and the use of his alarm reminders. So on the system level, here we have 3 strategies that have been used: clinical, managed care, and advocacy. The clinical strategy has been mainly used by his home health nurse as she continually assesses his health and monitors his stability and progress towards a healthier condition. She plans his care in partnership with MJ and his family and uses specific interventions such as teaching and demonstration. Ensuring his PICC line is in proper working condition and the dressing is clean, dry, and intact. The nurse is responsible for MJ's overall progress and communicates with other members of the multidisciplinary team to keep track and document his progress toward healing. The case manager has used managed care as she plans and coordinates the resources and services that MJ will receive. The case manager is also responsible for cost containment and resource management. The case manager must balance MJ's needs with the cost of services required for his recovery. Lastly, and honestly most importantly, the home health nurse and case manager both use communication to coordinate care, as well as, also very important, to advocate for the patient to receive the most relevant and appropriate care to turn his health trajectory in a positive direction. So I'd like to highlight a few interventions supported by studies and articles written to support the effectiveness of some of the strategies that we discussed just a moment ago. When discussing coaching, which falls within the microstrategy education, Gorab et al. States, in subsequent interactions, the coach and client discusses current and target clinical values for A1C, LDL, cholesterol, and blood pressure, self-management skills such as glucometer reading and appropriate strategies for hypoglycemia, taking medications as prescribed, and lifestyle changes around healthy eating, physical activity, and stress. On the macro level, or the system level, I'd like to highlight clinical management. When discussing interventions that have a focus during outpatient care, often performed by the primary care provider, but in MJ's case, the home health nurse will take on much of this role. Gleason states, effective self-management training requires an individualized approach to lifestyle modification, nutrition, exercise, and weight control, and if necessary, pharmacological therapy to achieve glycemic control. Achievement of optimal levels of blood sugar, hemoglobin A1C, lipids, and blood pressure are essential components of outpatient management. So for utilization review, conducting a utilization review is important to ensure that proper allocation of resources is occurring and that the patient is receiving all necessary interventions and supplies. The resources and interventions MJ will receive include home health visits each day for 6 weeks. MJ will be sent home with the necessary equipment to administer antibiotics and supplies needed to keep his dressing dry and intact. These supplies include an IV pump, piggyback and primary tubing, antibiotics, and a 250 ml normal saline bags for piggybacking. Medications will be obtained from the pharmacy, but also alcohol swabs, flushes, waterproof PICC line dressing covers for showering. It has been determined that everything MJ will receive is a needed resource for his safe recovery. So quality and safety issues for MJ include inability to operate an IV pump correctly, missing antibiotic doses, double dosing himself, infection of a PICC line, needing a dressing change once the home health nurse has left his house, pulling or dislodging the PICC line. All of the solutions to these problems revolve around patient education. MJ and his daughter have both demonstrated safe use of equipment and an understanding of the treatment plan. So the nurse case management interventions have been effective on the patient level. MJ has shown marked improvement and has shown that he is able to manage the equipment for his acute problem and has a new interest in managing his diabetes more effectively. So on the system level, there are three that we have that I've included: clinical, managed care, and advocacy. The nurse case management interventions have been effective in the system level. The home health nurse is effectively managing MJ's care and monitoring his progress toward health. The case manager has also effectively used managed care to allocate resources for MJ while utilizing cost containment strategies. The home health nurse and case manager have effectively advocated for safe, consistent care and have opened a pathway to a healthy future for MJ through advocacy and all of the other interventions that we've discussed today. So here, oops, not that one, but here are the references that that I used to obtain the interventions for MJ. And thank you very much for listening, and I appreciate all of your time and effort through this course. Thank you so much.